Thank you very much. Yes, I did just run 4 half marathons in 4 months. It's funny, everybody, I post that on, I'm not a big Facebook poster, but I did say that because for some, I run about 4 or 5 a year. I have for the past, I don't know how many years. But I've never done 4 in 4 months. And this past week when I finished the 4th one, I was like, yeah, I'm a little bit tired. And I was a little bit proud too, and I don't usually post that. So I posted it and everybody's like making a big deal about it. But honestly, it was just one of many. So it's about staying healthy. You know, it's funny, I was thinking about my title after Dr. Glick, and I thought about it's the Stomatognathic connection. And I thought, oh crap, is it the relationship? Is it the association? Is it the causation? I was like, crap, I need to change my title now too. So I don't know what the hell it is, except we're gonna talk about a health-centered patient and the connection, association, causation, something of the stomatognathic system. And that's what we're gonna talk about. It's really an honor for me to be standing here this morning in front of this association. I'm 48 years old this year. And so I'm sort of at that point where I have enough to look back upon, and also I have a lot to look forward to right now. So I really am honored to be here, and I want to share with some of the younger dentists and respect the older dentists that one of the reasons that I have the honor of standing here in front of you are a few people that are here today. Because without these people, I wouldn't be standing here. Without their mentorship, I wouldn't be standing here. Without some humility and some people creating a safe environment for me, I would not be standing here. Lots of people in this room have been impacted by David Latz. I've learned so much from David, and I would not be standing here without David. He's a huge part of this society, and I hope that we can all learn from people like David, and then we get to keep teaching people like David. There's another guy on the left-hand side of this photo, Gary DeWood. Gary DeWood I've known for a long time, a mentor, a friend, and most recently a colleague as well. And it was actually in this photo that you see here, Gary and I were teaching a study club together. Well, no, actually, let me switch the story. The guy on the far right, Glenn Joyce, who I'll mention in a moment, we were teaching a study club in Washington. And Gary, as he always does, said, dude, can I come along? He's like, I don't want any money, I just want to hang out with you guys. I'm like, yeah, come on. So Gary comes along, but notice he brought his loops. So he's like, yeah, I'll just come along. So anyway, so Gary comes along, and we're sitting there, and it was like a day 2, beginning of day 2, and he's like, Kevin, he goes, I've been sitting here, he goes, I've known you for years and years. He said, he has this line about something about slaying your mentor. I'm like, dude, I do not want to slay you. And he goes, no, he says, that's a compliment, Kevin. And I remember that day vividly because Gary has been such a mentor in my life. Now, the guy on the far right that you see is Glenn Joyce. And Glenn Joyce is probably the best friend anybody can have in the entire world. We met at the Pankey Institute back in the early 2000s, and he is my best friend and will always be my best friend. But how did we meet? We met at the Pankey Institute. And we came together and have been friends teaching and learning together our whole lives. Now, the person that sort of brings us together and brings this world together, in my opinion, is the person in between us in this photo, and that is Margie Mannering, who has impacted many of us, and she's in this room as well. She is the epitome of what a non-judgmental mentor friend should be for everybody. So for all of the younger dentists in here, find somebody like that. For people who are 48, give back like that. For people who are a little bit older than that, you can still do it. So I felt like I wanted to take this moment and say that's what this society is all about, and that's the reason I am so humbled to be standing here in front of you this morning. Jason said to me almost 2 years ago now, he's like, Kevin, I want you to talk about the connection between the stomatognathic system and a health-centered patient. And I'm like, I go, what do you mean? He goes, well, talk about how occlusion fits into it. And then I'm like, well, let's talk more about that. And he goes, well, it's almost like, how is it related? How is it all related? And I'm like, oh, okay, how is it all related? And how does it all come together in the stomatognathic system? And I thought, well, I'm not quite sure what you mean. Because what we didn't talk about is this. What is the it? So the it is what we're going to talk about, and how the stomatognathic system fits into it is a big part of that. So what is the it? The it starts with this. The it starts with every single patient making an assumption that every single patient, every single person in this room, I'm going to make a safe assumption that you all want to be healthy. I think if we walked down Michigan Avenue today and we asked everybody and said, do you want to be healthy? Do you think there's anybody that's going to go, nah? No, they do. So we have to make that assumption. But healthy in which way? When we talk about health, it's big health. We started talking about it all day yesterday, and we're going to continue it today. It's dental health. That's the Stomatognathic system for sure. But it's also mental health. We all struggle with a little bit of anxiety and depression. It's nutritional health. It's what we talked about yesterday. I didn't know if I was supposed to blend my smoothie this morning or not. I started eating the kale this morning instead of putting it in the blender. I want to know what it is to be healthy. And it might just be happiness. So I make the assumption that every person in this room and every patient that walks in wants to be happy. If we start with that, it helps when a patient like Orson walks in. Because you could make a case when you look at Orson and Orson's teeth that this dude does not want to be healthy. He's a lost cause. He's 42 years old. Except Orson walks in, and without me even having to think about it, I say to myself, he wants to be healthy. Of course he wants to be healthy. In every way that's possible, he wants to be healthy and happy. So the it starts with that everybody, make an assumption, a safe assumption that everybody wants to be healthy. And then we come back into the Stomatognathic system. We do have to assess our patients, but how do we assess them? We have to assess them in what we have been trained to do, which is looking at the joints and the muscles and teeth and the periodontium. But the way we look at them is a little bit different, because this is the system. And our system is connected, right? It's a closed system. Everything about that affects everything else, which means we have to look at each patient, we have to evaluate the system in a really systematic way, if you will. And for some of us, especially coming out of dental school in our early years, this right here, this system became overwhelming. We're like, dude, I just want to deal with teeth. So I'm going to tell you a quick story. About 3 or 4 years ago, I was at the Restorative Academy that's at the end of this week. And it was on the last day, and I'd been here 7 or 8 days for a lot of meetings this week. And I was leaving the Ritz Hotel, and I was at the elevator on the way down with my suitcase, just dying to get on the plane and go home. And I'm like, I don't want to talk to anybody. I'm just, no offense, I'm an introvert. Like, I'm tired at this point. And so I'm at the elevator, and some guy, some older gentleman, is like, are you Kevin Quishan? I'm like, come on, yeah. So you know me? He goes, yeah, I know you. He goes, you know, like, would you, like, and he's with this beautiful younger lady, turns out to be his daughter, and he says to his daughter, would you, no, that story is not going there. He goes, would you mind taking, he says to his daughter, would you mind taking a picture of me and Kevin? And yeah, he goes, you know, and I'll send it to you later. Can I have your email address? And I go, yeah. So a couple weeks later, I get this through my email. And so honestly, so the story is the exact opposite. I'm on the way down the elevator, and I'm like, oh my God, Pete. And it was his daughter. And I'm like, would you mind taking a picture of me and Pete? So that's the true story. I have to share it with you. But what I did tell Pete, though, because I said, you know what? I've been to Pankey. I've done a bunch with Spears, you know. I have never been to the place where Pete has been teaching for my whole career. However, what I do have is this. And I have abused the crap out of this. In fact, I said to Pete, I go, Pete, you actually don't know me. I said, but I know you so well. In fact, you made something that's so complicated, that it's so simple that even I can understand it. And in fact, when I was teaching at the dental school, you'd be rich if you knew how many of those pages I copied and gave to hundreds of dental students every year. It's true. We never made it part of the books they have to get, right? But I was like, because you have to get the faculty approved and everything, so I copied the crap out of this book, put it in all of my lectures and courses, and so now all of these students have been impacted by him. I share that with you because as we're evaluating the Stomatognathic system, we have to think about what it is. And what Pete says is, in a perfect world, this is what we'd love to have. Freedom from disease in all masticatory structures, maintainably healthy periodontium, stable joints, stable occlusion, healthy teeth, comfortable function, and optimum aesthetics. Pretty simple. And so now when we look at the system, we go, oh, I get that if this is optimal, I can see what's not optimal as I come through and do my exam. Which means that when we do our exam, we have to think a little bit like as if we could actually look underneath everybody's tissue. I mean, you can. And it doesn't have to take so long. So we have this vision of what we think is going on underneath the tissue. What do we think's happening with the joint? Where do we think the disc is? It's a best guess, but it's a pretty darn good guess when we do it with intention. And the same with muscles. Excuse me. The same with muscles. What muscles are being overworked? How are they not in harmony with the rest of the system? So we have to intentionally look at joints and muscles. Now, I could spend all morning talking to you about this. It's one of my favorite topics. But we're going to look at the connection with it. So we have to look at joints and muscles. And yes, we have to look at Orson's teeth. We're all good at that. And we look at his periodontium. We're all good at that. But there's one other thing we look at, because we said that the system is connected, right? We have to look at how Orson's teeth are coming together. Now, I'm a big fan of using tape or silk, but you can use a T-scan, you can use anything you want, but how are his teeth coming together? When he moves from side to side, are his guiding teeth guiding his back teeth apart and protecting them? Are his squeezing teeth in the back touching evenly and simultaneously? And if not, that's going to affect the whole system. So for me, a big part of the it is a comprehensive, intentional look at how the system is working. So that's a part of the it. But now as we move on, so I have an idea of what's going on with Orson right now. I have a pretty good idea. But now is when we talk about health-centered patients. We're all good at this so far. We can be with people like Pete and our mentors like Margie and David and Gary. But now we have to assess what actually affects the system. The good news is that when you go back next week, I'm going to start to make the connection of this year's meeting and next year's meeting. When you go back next week, it's really only 3 main things that affect the system. It's sleep, nutrition, and what I'm going to, for right now, call wellness. And so I understand what's going on with Orson's system, and now let's look at the 3 things that affect the system. Sleep, how do you do this in your practice? So many of us have been doing it. Again, this is my medical dental history from 2009 in my practice, when I started to realize that sleep was a big part of what's going on in the stomatognathic system. How did I integrate it into my practice? We all have a section of our health history, and I had added TMJ history because of Pankey and Spear and everything that I learned. But then I added a section that's called sleep, snoring, and apnea history. My patients filled this out before they even met me. Like, what the hell is this section? Well, I'll fill it out anyway. Not only did they have to fill this out and realize that we were going to talk about it, but every new patient also filled this out. An Epworth sleepiness scale, you're all familiar with it. A lot of people, by the way, call it an Epworthiness sleepy scale, right? That's not good for anything. Really? Because my patients now know that there's something related to it. It allows them to become curious about it. It's far from worthless. It's the Epworth sleepiness scale. So I have them all fill it out, and they're like, this is weird. Nobody's ever done this before. Yeah, I know. Or you could do the stop bang if you want. It's just 8 quick questions to see if you're high risk or low risk for what might be some breathing issues. And my favorite actually is this. If they actually have a bed partner fill out a bed partner survey. It's their bed partner's, basically, it's the Epworth sleepiness scale for the bed partner, and it's a few other questions that they love to fill out, by the way. You're like, oh my God, I've been dying to tell somebody about this for years. Right? Thank God. I love your dentist. Can I go too? I mean, it happens. But then they actually have something to talk about before they've even met you. And they're like, Kevin, why? I filled out all this stuff. It's nice to meet you. Why all this stuff on sleep? And I say to them, you know, honestly, and this is in 2009 when I first started doing it, I say, I'm behind the times. We've known, it's been in the literature since 2004 that, like, and think about Orson. If we just want to do what Bob Barkley would say for Orson, which is to help him get worse at the slowest possible rate, slap a piece of plastic between his teeth and at least slow it down a little bit. And that's what we all did for years until we realized that the piece of plastic we put between their teeth might be suffocating them. However, that piece of plastic that we were putting in there, that occlusal splint, might be making them worse. So I said, I can't just put that between your teeth anymore. And actually what I do know is what's happening at nighttime is related to sleep. Bruxism is related to sleep, hence the first word, sleep. So I have to ask you about this because it's related to what I think I'm seeing in your mouth right now. And actually, because I make the assumption that you want to be healthy, I happen to know that there are consequences. And I want you to be as healthy as possible. I want to use my gifts and tools to help move you towards health in a manner that's most appropriate for you. So of course I'm going to ask about sleep. There's consequences. How do you feel during the day? And if we did take a scan, I could even take a quick peek at how big's his air hole. Now, let's get serious about this right now. This is by no means diagnostic. This is just a nice screening tool. It's like if I took a CBCT, let's look at your air hole. Is it big or is it little? If it's little, I'm like, it looks like you might be struggling to get air in. It might not mean you're apneic, it's just a way to help us look at patients. But now they see why. If I'm worried, and I was worried about Orson, I could screen, right? We talked about this yesterday, and we've been talking about it in this society for years, is maybe I want to do a sleep test, a home sleep test. This is not diagnostic either, by the way. God, no. It's a screening tool that I can look at Orson and go, yeah, you know what? It looks like actually when you sleep on your side, you have phenomenal sleep. Yeah, you have an AHI of 2.7 when you sleep on your side, and you have it's 28.1 when you sleep on your back. So although I want you to look closer into your sleep, maybe for now, just sleep on your side. And by the way, what I also know is that your BMI is 28.8. Maybe we could help you be a little bit healthier and sleep on your side, and you're going to feel great because it might be affecting what I'm seeing in your teeth. Sort of all makes sense. And Orson's like, wow, nobody's ever said this before. I'm like, I think it might be related. Because it is. It's a closed system. So we're going to look at sleep and talk about that. And now we talk about sleep. And do you think that nutrition might be associated with how Orson's teeth look? So I have an excuse. I'm like, Orson, what I'm seeing in your teeth might be related to what you're eating and drinking. We've known this for years, everybody in this room. Except we can look at it with intention. Now, it's interesting. I'm going to watch the clock a little bit here, but the reason that Orson, his history real quickly, is that he actually had been drinking about 12 soda pops since he was young, a day. And I said, do you think that might be related to what's going on with your teeth? He goes, yeah, people have told me that before. And he goes, but I drink Diet Cokes now. This is a true story. Well, that's good for you. I go, but there's sort of some acid in that might be affecting what's going on with your teeth, and maybe we should look at that. So I started using a nutritionist, Christy. And I said, Orson, fill something out, and Christy sends back a little assessment of how Orson is eating. It doesn't take that long, but I'm going to help him be healthy because it's associated with what we're seeing in his teeth. We know it's connected. We talked about it all day yesterday ad nauseum, except good nauseum. But we know it's connected. And so now I can say to Orson, yeah, let's look at your nutrition and see what's going on. And he's like, this is very different. I go, you know what? We've been trying to talk about it for years. If you look at this article here, look at the date, 1982. Nutrition Instruction for Health Professionals and Students, Strategies for the 80s. Strategies for the 80s. Now you look at this 2014 article, it talks about everything. It talks about dental caries, food intake, and lifestyle. This is a 2014 article. Another 2014 article basically says that nutrition education for healthcare professionals, a call to action. What the hell happened to the 80s? It's 2014. And in fact, look at that same journal that made the publication in the 1980s. Look what they published in 2017, last year. The Shrinking of Formalized Nutrition Education in the Health Professions Curriculum and Postgraduate Training. They're like, I don't think our plan for the 80s worked. This is a bummer, except we've been talking about it for a while. We know that in 2017, this great article, Improved Nutritional Intake, Better Sleep Patterns. Of course it's connected. It's a closed system. How could we not talk about it with our patients? We must talk about it with our patients in an intentional way, and it doesn't take that long. So we talked about sleep, we talked about nutrition, and of course those are related to how happy we are. And I have an issue with this term wellness right now. It's corporate wellness, it's sort of a tagline, it's sort of a trendy thing. I don't love trends very much, I try and stay away from them. But I don't care what you call it, you have to call it something. And so go ahead and call it wellness. I call it, Christy, the nutritionist that I've been working with, and also she feels passionate about this term vitality. So I don't care if you all in this room want to be well, but I'll bet you would all love to feel vital. What does vital feel like to you right now? If you had to put 3 words down in front of you, what does vital mean? What would those words be? Because I'll bet it'd be pretty well. And so I said to Orson, you know what? Let's go ahead. This same person that did your nutritional intake that we're using actually also has this. So Christy gives me this. And in fact, I have to be quite honest with you, before I did all this started with patients and Christy turned me on to this, I go, you know what? I think I should probably experience this before I do it with my patients. And she goes, yeah. And I said, and I'm sort of into health, as you can tell. And so I said, let's try it. And I said, I know what mine's going to be, you know. Of course, I'm going to be super healthy and well. And so, of course, my nutritional comes back, and she's like, hey, you could do some things. And then I filled this out ahead of time, and the same thing as Orson. And so basically it starts off as a stress audit, and it comes into different categories: coping and social support. I get 7 to 8 hours of sleep. Do I wake up feeling rested? Hell no, I don't, by the way. So I'm filling this out, and I'm like, do I have a network of friends and acquaintances? You know, not sort of where I live. And I'm like, yeah, whatever. Let's keep moving on with this one, right? So the next section is muscular. And it's like, do I have a stuttery voice? I don't know if you can hear mine right now. It's a little bit shaky and stuttery. Do I have tension headaches? Sometimes. Do I have trembling or shaking? Yes. Do I have back pain? I thought that's just because I work out. Except there was a lot of yeses to these. I'm like, oh, this will be great for my patients, right? And then immune system, right? Do I have allergies? Yeah. Do I have mono? No, I don't, by the way. Do I have herpes? No. And I'm like, see, I'm back in. I'm batting 500 again. I'm doing all right, right? And then endocrine system, and it's like, good news, I don't have menstrual difficulties, so this was good for me. But I do actually feel fatigue, feeling tired a lot. I have excessive thirst. I'm like, I thought that was because I lived in the desert. Changes in skin color, I thought that was because I lived in the desert. So I'm now back, I'm not batting 500 anymore. Cognitive stress systems, poor memory, absolutely, actually I do. Indecisiveness, yes. Confusion, yes. Racing thoughts, you can tell how fast I'm talking right now. Difficulty falling asleep, got you there, because I'm flipping exhausted every nighttime I go to sleep. Difficulty concentration, yes. Preoccupation, yes. I'm like, Christy, I think this sucks. Let's move on to the next section. And then she goes, yeah, let's move on to it. Do you feel like things are getting out of control? Maybe. You have anxiety or panic? Yes. Are you frustrated? Why do you ask? You feeling trapped or helpless? Yeah, I want the hell out of here right now. And I'm just sort of getting depressed. So now I'm almost batting 1,000 on these sections. I'm like, this will be good for Orson, right? And then parasympathetic nervous systems, and I'm like, I won't talk about my impotence right now, but we can talk about other, cold hands and feet, rapid heart rate, headaches, sometimes chest pain. I'm like, wow, this is really interesting. And so what Christy helped me see is that we can help our patients look at nutrition and vitality, call it wellness or call it vitality. And now we're going to take all of these things right now, and we're going to look at wellness, because we know it's in the literature too. And I am pretty good at looking at literature. I don't just read the abstracts well, I do just read the abstracts and conclusions, and then if I like them, I go back and check it. So, but weight loss and nutritional psychoeducation, it is connected. This is my mom. Dietary intake and sleep habits for women between 60 and 90 years old. And so I put a little quote on this. I don't like to read you a lot, but it's essential that the elderly women are provided with pro-health education covering their nutrition as well as sleep hygiene. These are our patients. By the way, this is me. I eat lots of fish because I want to sleep better, but I'm struggling with cognitive function some days. This is me. This is a 2017 article. You see, because it's all related. It's all connected. It's a big part of the it. This is my son, 20 years old, in college right now. Lifestyle practices promote health, lessen risk of unintentional weight gain, reduce the risk of developing chronic illness. I want that for my son. By the way, this is me. This is overtraining syndrome. This is a 2018 article that I got, it's preprint. When it says overtraining syndrome appears to induce dehydration, increase body fat, decrease libido, and worsen mood. I'm like, shit, did they find me? Like, are you kidding me? I want to be well. And so do our patients, but it's connected to sleep and it's connected to nutrition. But yet we have to be able to eat and smile. It's all related. That's a big part of the it. So not only do we make an assumption that everybody wants to be healthy, but we assess the system, the whole stomatognathic system with intention, but then we have to look at the things that affect the system. And now we come back to what Jason asked me to talk about, which is, what is optimal? And when we talk about what is optimal, what would it take to restore our patients back to optimal health? Now, for me and for a lot of us in here, I don't care. I love Bill Robbins, the global diagnosis, Pankey, Coyce, OBI, Dawson, Texas. I don't care what it is, as long as you have a systematic way to be able to see what optimal is for every patient. For every patient. Because if we don't know what optimal is for patients, in fact, one of my mentors, Mary Osborne, who's here, and Joan Undershoots, I've been influenced by so many great people, say, if we don't know what's optimal for our patients and hold it up here as possible, we'll never be able to move towards it. So for every patient, we now know what is going to be, what does it take to move towards optimal? It can be facially generated treatment planning, it can be analog, it can be digital, but the digital stuff's not going to work if you don't know what you're doing in the first place. So what is optimal? What would be optimal for Orson, right? Well, you know, it's interesting. Oops, let me make sure this slide goes. Because sometimes we think, I'm just going to restore Orson to optimal, and he's going to love it. But you remember what Orson's teeth look like. We're going to look at him again. If we just restored him to optimal and said, Orson, that is awesome, and he goes like this. And you go, oh, that sounds great. And he goes, feels like crap. That would be terrible, wouldn't it? So one of the things that's a big part of the it with helping to restore people is maybe you give them an opportunity, especially people like Orson, to feel what optimal feels like. To prove to yourself that you can create comfort and harmony before you start making changes to teeth. And so this is what a lot of us in this room would call a Tanner appliance, Henry Tanner, that David Latz and Margie just pounded into my brain years ago. That's the old school way to do it, that I still do it, but you can do it. You can have them fabricated digitally upper, you can have them fabricated digitally lower. I don't care what it is. It just might be a good idea for some patients to help them feel what optimal feels like before you go making changes. Because if we're going to actually manage their airway, then the appliance that they might be wearing on a regular basis might look like this. And so now you say, well, yeah, Kevin, why do we even want to restore them to optimal if we're going to be jacking their whole system forward every night? And so that's another one of my passions is, yeah, if we're going to be pulling everybody's mandible forward every night to manage, but not fix, but to manage their airway, does that mean that they're just condemned to crappy teeth the rest of their life? You're like, yeah, you're going to be all jacked up all night anyway. It's not worth restoring you to optimal. No. In fact, that gives us an opportunity to restore to optimal because they're going to be jacking their jaw forward all night, every night. So we do have to know what optimal is, help them feel like that so they know that during the day what optimal feels like after they take their appliance out to help them deal with sleep so they can feel better on a regular basis. So now that we know what it feels like, they know what it feels like, and we've proven to ourselves we can create comfort. It's now that we come back to what Jason asked me to talk about, which is, it goes back to the basics. Whether you're in the digital world on the right or the analog world on the left, it's all the same. We have to take this person who's sort of beat up and broken down and find out what optimal looks like. And it does all start with the front teeth, right? Because what's the job of the front teeth? To protect the back teeth. So what we do is we have to figure out on whether it be analog or digital, we have to mount models. We do. I'm sorry, the younger people in here. You do. The good news is in the digital world, it's going to become easier. But we have to mount models in a fully seated condylar position with an articulator that is as close to you as possible, even changing the condylar inclination to fit you. But now when we do things on the articulator, the good news is we can trust it. And that makes predictability go up and confidence go up and fun in our offices go up every day. So what are we going to do on these models mounted on a fully adjustable articulator? We're going to put the top front teeth where they belong in the head and the bottom front teeth where they belong in the head, and then we're going to move it in every direction. Cuspid rise all the way to crossover as far as you can go. Cuspid rise all the way to crossover as far as you can go in an end-to-end position. Now I've got the guiders in the right place in the head, and I've got them guiding smoothly and shallowly. They're doing their job. Step one, it doesn't take a lot. It can be really ugly like my wax is. It's okay, the edge is in the right position in the head and they're guiding shallowly and smoothly. And then we have to look at the squeezers in the back. I'd like to get them all touching evenly and simultaneously with the cusp tip touching a flat landing area. It's that simple. So we have to look at sort of what's close. Margie calls it planning your stops. It can be ugly just like this. But at least I know where I want every cusp tip and landing area to touch evenly and simultaneously, and making sure that the front teeth exclude them when I move in any direction. So that's optimal, and if we know that, we can now move into the digital world and plan it digitally, maybe even a little bit easier, and that's what we did for Orson here, doing it both analog and digital, helping him move towards health. So the part of the it then, after we know what optimal looks like, here is really a key part of this for me, and that is being worried or concerned about the patient. It sounds funny, except it's a game changer. Because I want everybody to be healthy, I make the assumption that they want to be healthy, and then I actually know that form follows function. I know that. And so I look at Orson's, his models, either the digital ones or the analog ones, and then I look at Orson's teeth, and I can be genuinely worried or concerned. I'm worried, Orson, that if we just put a new crown on that lower right molar that you came in for that just popped off, that if that's all we do, that we're just going to put it back into the situation that caused it to break down in the first place. I'm concerned that if we don't take a step back and look at what caused it in the first place, whether it be nutrition, sleep, wellness, the way your teeth are coming together, the position they're in your teeth, that you're going to be going through this again. Now, if I can look at every patient and be genuinely worried or concerned, and they feel that from my heart, then they go, dude, he means it. Like, he's really actually worried about me. So this is a big part of the it. If we're genuinely worried or concerned, and now though, if we're genuinely worried or concerned and we know what's possible because we visualized the optimal end before we started, now we can say to Orson, let's find out what's appropriate for you. Because if we know where we want to be, whether it be in the digital world or in the analog world, basically for Orson, it's basically just like resurfacing his teeth. And so the appropriate steps for Orson might actually be something like this. Take what you see on the models and go, you know what you need? You just need your teeth resurfaced. And what might be appropriate is to put some plastic on there right now and help you feel what you felt like when you were wearing the appliance, and do that. And he's like, can you do that? I'm like, the good news is these days we can. He goes, but my teeth are all yellow. Can we cover them? And I go, well, this is how it would look if we did this, and maybe it'll remind you that you want to keep doing dentistry. But we could resurface just like that. That might be appropriate for Orson because he can't afford all the dentistry right now. Or if we know it's going to be longer, Matt Roberts is doing this lab work for me. He goes, you know what, I'll do these super duper 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 cool thin things that you can put over his existing teeth, but we already know where we want them. And I go, yeah, do those too. So we tried both in. And honestly, we resurfaced his teeth. This is what I decided to use. Now, it should not be a surprise to you that I knew where to put composite on his lower incisors because those were his guiding teeth, the same as I did on the articulator. And I put these overlays on his back teeth on the bottom and all of his front teeth, or all of the teeth on the top. And lo and behold, he goes cuspid rise to crossover, and end to end. His guiding teeth are guiding. And his back teeth are touching, I wouldn't say evenly and simultaneously with these overlays, but he's got the ball in the socket with lots of back teeth touching, with the guiders guiding him, and he walks out in one day feeling like he felt on the appliance. That was what was appropriate for Orson. And in fact, the good news is, he's like, yeah, I sort of like to smile, and yeah, it feels pretty good. So now I have an opportunity to come in, he's in this stable environment, and help him move towards health in a way that's appropriate. So coming back to the stomatognathic system, my goal is to make sure the guiders are always guiding and the squeezers are always squeezing, and they're all working together in harmony. So I can come in now and I can prep his front 6 teeth and put provisionals on, and when I put those provisionals on, they're not perfect, but he's like, oh yeah, guiding pretty smooth, yeah, tap together, yeah, pretty good. And so when he leaves today, he actually basically has the ball in the socket with most back teeth touching mostly evenly and simultaneously, with the guiding teeth mostly discluding them. Not so bad. And now I say to Matt, I'm like, Matt, here's my provisionals that I did. I think we can dial those in, but the guidance was pretty good. And Matt goes, oh, yeah, but I can make them look a little bit better. And I can double check the function for you. So Matt goes, yeah, I know where you want the edges. I'm going to make them look pretty good. Orson comes back in. There should be no surprise when I put them in. Cuspid rise to crossover as far as he can go. Cuspid rise to crossover as far as he can go, and beautiful end to end. The guiders are there, still protecting all those overlays on the back teeth. He's still pretty healthy. And by the way, he's sleeping really great, and he's eating better. And he's feeling pretty vital too. I'm like, this is fun stuff. And so now basically his guiders are in. So that, by the way, is your full-time Lucia jig. This is your full-time leaf gauge. This is your full-time joint seater. So I can prep his back teeth now, and basically when I take his bite, it's like, yeah, bite together. I got your vertical dimension. So this is what was appropriate. So as I'm making his provisionals, I can dial him in just a little bit more, but he leaves today feeling pretty great. So when I put just the top teeth in the next time he comes in, they're not perfect because he still has the onlays on the bottom. But what I've done is I knew where I wanted the cusp tips on the top, and I knew where I wanted the flat landing areas. So they're like setting the stage for these lower teeth. The lower teeth are looking up right now going, I can't wait, look at what I've got coming for me, right? I got it as a solid foundation. It's awesome. And so it's not perfect, but what you can see is there's a lot of back teeth touching fairly evenly and simultaneously. But Orson says to me, Kevin, that last appointment when we did both quadrants, that sucked, man. And I go, yeah, it totally sucked. I was tired. He goes, can we do one quadrant at a time now? I go, yeah, please. So we can do one quadrant. The cool thing is in the digital world, I can prep and scan one day, and then I can prep and scan another day and just stitch it all together. So it's like I did it all at one time. Pretty fun stuff. So now I can help move him towards health. The cool thing is, I know where I want these bottom teeth to be. It's planning your stops, right? The same thing I did on the models you do in the digital world. I now know where I want the cusp tips on these lower teeth. They've got beautiful flat landing areas waiting on top. I've got beautiful cusp tips on top looking down going, give me a good place to land. And lo and behold, exactly as we designed it, it's with intention. Cusp tips to flat landing areas. It's not by accident anymore. You do it with intention. The Stomatognathic system plays a pretty big role in helping people be healthy. And so we've got cusp tips to flat landing areas. The guiding teeth are guiding. And when I go to put them in, basically right off the bat, it's like, well, that's not a bad start because we planned it. If you pay close attention to the photos right now, and I'm not making this look easier than it is with just a couple of adjustments because we did it with intention, I have lots of back teeth touching cusp tip to flat landing area, and the front teeth are touching also. I have to lighten them up just a smidge right now, but the guiders are guiding, the squeezers are squeezing, and notice it looks exactly as we planned it. It makes it really easy, almost too fun and too easy. And so now Orson, he walks out, and he's like, not only does he make this sound, he's like, that's solid, but he's got the guiders guiding, cuspid rise to crossover, end to end, and you know what? He's looking pretty good. That's what was appropriate for Orson. While we're dealing with his sleep, while we're dealing with his nutrition, and while we're helping him feel well. He's a funky little guy. I love him. He's like, I just feel great, Kev. Yeah, he's great. Now, I'm going to spend the last, probably a little bit, I'll finish a couple minutes early. I'll spend the last 5 minutes here talking about the rest of the it. Because now we've done appropriate steps, and now we always come back to the assumption that he still wants to be healthy. Always moving, always coming around this. This to me is the it. It doesn't need to be so complicated. And you can incorporate into your practice next week, except there's one thing that's missing that I feel like I want to take 5 minutes and share with you. And that is, it sounds great as we sit here. There's one key thing that's missing. And it's for every single one of these steps, you're going to struggle unless you got people on board with you, right? You have to create systems around this in your practice. It's clutch. And so for the last few minutes, I want to share with you what I've learned quite a bit. And that is when we share this with our team members, it really is all about, it's a bigger picture. You come up here even above the Stomatognathic system, above everything, and it's about what we all learn, sometimes harder than others, which I'm one of those, is about being authentic. Because if we want to have team members support us, then the first thing we have to do is, I'm sorry, we are going back to this every time, we got to look in the mirror and go, when I'm with my team, am I my authentic self? With an open mind, with an awake body, and with a tender heart. A book that I will highly recommend for you that changes the way you will communicate, there's so many out there, right? We all want to be happy and healthy. It's the 5 Keys to Mindful Communication. How do we communicate with other people? If we create this environment in our practices, then it's going to be congruent when we start having the conversations with our patients. Because otherwise, their patients are going to know it's not congruent, and they're going to feel that. So for instance, this is a friend of mine, Andy Cohen in Philadelphia. And Andy would find to be saying, in my practice, this is where he was years ago, he'd go, it is all about me. He's from Philly. He's like, of course it's all about me. And that's the way he would say it. And then he'd say, no, Kev, it's not about me. He'd say, it's about the business. But what you can see is around him, there are other people. And they all have their own needs, objectives, and challenges. Everybody does. Everybody in your practice has their own challenges, needs, and objectives. And so there's another book I'm going to bring to your attention right now that's called Outward Mindset. Could you imagine if Andy walked into his practice every day and he said to his assistant, I know, assistant, that you have your own needs, challenges, and objectives. But what can I do for you today to help you do the best work that you can possibly do? And he looked at his hygienist and said, I know you have your own needs, objectives, and challenges. What can I do for you to help you do your job to the best of your ability today? And he did the same for the front office. He did the same for his lab. He did the same for his associate. That's what we call outward mindset. And this book is a game changer by the Arbinger Institute. It's a different way of looking at things in your practice and the way you communicate as you being your authentic self. It's the same people that wrote the book, not shockingly enough, Leadership and Self-Deception. Another great book. But let's go back to outward mindset. So basically, could you imagine if not only is Andy doing that, but in our offices, because we want to be congruent, that your front office person walks in every day and looks at your assistant and says, assistant, I know you have your own needs, challenges, and objectives, but what can I do to help you do your job to the best of your ability? And the front office looks at the hygienist and says the same thing. But the cool thing is, not only does your front office do that, but your hygienist walks in every day and says to everybody on the team, I know you all have your own needs, challenges, and objectives. What can I do to help you do your job to the best of your ability? See, this isn't even a patient-centered practice, is it? In fact, because your assistant walks in and does the same thing, everybody walks in and does this, so we don't even want to have a patient-centered practice. That's passé as well now. Because years ago, Peter Senge started something, and then the Arbinger Institute followed up, and so many have. What you have at this point, when everybody's walking in and asking this question, is a team-centered practice. It's team-centered. We are all there to help and love and support each other. That is what it's all about. And the good news is Andy can now walk in his team-centered practice, and in this environment, in this culture that is absolutely spectacular, he actually can still walk in some days and say to his hygienist, I know you have your needs, challenges, and objectives. What can I do for you today to help you do your job to the best of your ability? But because we've created this environment, some days he can walk in and he can say to his assistant in front office, I need you today. I want to help you do your job to the best of your ability, but today, assistant, I know I'm struggling with this one patient. I know what it's about. Front office person, I need your help with them too. And you create this environment in your office because it's outward mindset. It creates this environment where it can all be team-centered together. And when we're team-centered, and I love this touchy-feely stuff, I don't know if everybody else does here, but when you do this and you do this with intention, these words are not just words anymore. It's respect, it's trust, it's humility, and yeah, I love the word love, I'm sorry. And your vulnerability. A lot of us are big Brené Brown fans. It's all about being vulnerable, creating that. Because when you are vulnerable, this is what everybody in the practice is. You are authentic, you feel vital, and then guess what happens? When you create this in your practice, it supports the it. Because now when you're talking to your patients, it's congruent. It's health. If we look at ourselves and say, how am I sleeping? How's my nutrition? How's my wellness? And we look at our team and we say, how's your sleep? How's your nutrition? How's your wellness? How's your stomatognathic system? And then we have a team-centered practice. Oh my God, the things that change. And they do, and we know that to be true. So there is a role, by the way, of the stomatognathic system in this, and I hope I shared that with you. But what is the part of the it? That's what we talked about. It is a big part of the it, but yet it takes everything there. For me, this is obviously, it's what I get passionate about. You can tell I get a little bit much sometimes. It is a big part of being happy. I'm going to make an assumption that every single one of you wants to be happy, wants to be healthy, does not want to be depressed, does not want to be anxious. And you want your team members to do that the same, and you want your patients to. So I got a little passionate at the end there, sorry. Everybody else was so funny, but I'm going to end just like that. I am so honored to be here. I hope everybody lives a happy, healthy, depression-free, anxiety-free. Blend your kale, it's fine. I did this morning, I feel fine. So thank you for your time.